Hi, everyone. It's Barbara Phillips with Nurse Practitioner Business Owner. And today I want to talk about copays, deductibles, and coinsurance because the question often comes up, do I have to collect this copay? Can I just waive it? Can I waive all of the copays? Can I waive all of the deductibles? And I think that there's some things that you really need to be careful about when you start thinking this way for your own practice. But before we can really talk about that, we really need to talk about just what all these terms really mean because not everybody understands. Your patients don't always understand. And as you probably have a good idea, your staff may not understand. And of course, there are plenty of providers that don't understand what these terms mean. Now, as a patient, I have a contract with my insurance company, my payer, that actually says I will pay X amount of dollars for certain things that come under copay, coinsurance, and deductible. As a practice owner, I have a contract with the payer, i.e., the insurance company, that says I will collect so much money from my patients, including the coinsurance, deductible, and copay. And of course, that varies with whatever plan that they're on. So both people, both sides of the equation, have a contract and have obligations, legal obligations to the insurance company that they have agreed to. So let's talk about those terms, deductible, copay, and coinsurance. And let's just start with deductible. Now, this is the amount that the patient has to pay out of pocket before the payer begins to pay their claims. So I might have a bill for $158.38 because I've come to see you for whatever. But my deductible is, let's just say it's $1,000. So I'm going to have to pay for that visit up to $1,000 for many visits until my insurance company says, okay, we'll start paying on this. Now, of course, as the practice continues to bill that so the insurance company can see, but they're going to get a statement back saying, no, this is patient responsibility. And in general, that patient responsibility will be the allowed amount, not the billed amount. Copay is the amount that I am required to pay every time I go in to see my provider. So if I have a copay, every time I have a visit, this is what I need to pay. That may be $0 depending on the insurance company. It may be $10, it may be $35, it could even be more than that. So it's per contract, whatever the contract says, that is the copay. So the coinsurance, let's talk about that for a moment. A coinsurance is a percentage of the allowed amount that the patient is responsible for after the deductible is met. And a lot of people get very confused about this. So if the insurance company allows, let's just say $100 for that particular visit, and if the coinsurance is 80%, that would be $80 of that. And I will owe the other $20 on that for the 20%. Now, in some cases, the coinsurance may be at 50%, it may be at 70%. It really varies with insurance companies and plans. But as you can see, this is even more money that's coming out of the patient's pocket, out of our pockets. It gets pretty confusing. Fortunately, the insurance company sends an EOB to the patients. That's the explanation of benefits. And we, as the practice, also gets an explanation of benefits. Now, I know I've had patients bring these in. They don't always understand what is being said on these pieces of paper, but basically it says the date of service, the level of service, the allowed amounts, if the deductible has been met, and what the patient responsibility is, as well as what they are paying the practice. So it is laid out there. You just need somebody usually to just sit down and go through it with the patient so that they understand what their responsibility is. So now this brings us to the question, can we waive any of these fees? Well, if you go back to what I said earlier, we have a contract with the payer with the insurance company. So, as a practice and as an individual patient, we are obligated to pay, the patients are obligated to pay a certain amount that they have agreed to. And I, as the provider, as the clinic, am obligated to collect that money. Not doing so might lead to an allegation of fraud. So you need to be very careful here. You have agreed to collect a certain amount of money, and the patient has agreed to pay a certain amount of money. Now, are there exceptions to the rules? Usually there are, but take a good look at your contracts, and if you are unsure, check with the payer. The other thing that you need to think about as a practice owner is how is this going to affect your cash flow? If you were to waive all of your copays for all of your patients coming in, and let's just say to make it easy, everybody is $10, you had 20 patients that day, so that's $200. And if you were to do that 5 days a week, or even, let's just say 48 weeks out of the year, that is a significant amount of money that you can be leaving on the table. And the issue here is you need to think about the cash flow of your business. Just like I need to have blood flowing through my veins, your business must have cash flowing through it in order to keep that business viable. There is no such thing as free healthcare. Even if you were to change your business model so that you could operate a free clinic, and I have free in air quotes here, you still need to be collecting money somewhere. You need to be getting donations. You need money coming in through grants. Whatever you can do to bring money into the practice so that you can offer free health care. A business cannot operate without money coming in. You cannot pay your staff. You cannot pay your overhead for the practice. So there has to be money coming in. And so when we get people asking the question, well, I don't want to charge my patients, you need to be aware of how are you going to operate this business? And so when you start looking at not collecting deductibles, coinsurance, or copays, depending on how you want to do this, you need to first look at your legal obligations, and secondly, you need to look at your cash flow. And again, like I said, there are exceptions to the rule, but it also depends on the business model you've set up. So if you are a member of NPBO, you can log in, and we've done a whole webinar on this, and that's there for you. The other thing that often happens when we start talking about collecting money and training our front desk staff, coaching our front desk staff, they don't know what to do. They don't know how to easily ask for money and feel comfortable with it. They don't know how to do it authentically and sensitively. And so again, for owners, log in, go to the webinar. You will see some scripts that you can coach your staff on, and that will help them be able to collect money in an easier manner. And for everyone else, if you are watching this any place other than on our blog at npbusiness.org, I encourage you to go over there, add to the comments, give your feedback and opinion on this topic and any other topic. So that's it for this time, and I will see you again soon. Thanks, and bye-bye now.